Hi, I'm Rachel, and me and my friend Kristen are here to talk to you about prenatal care and how to have a healthy 9 months for both you and your new baby. So you've taken the test and you're pregnant. And I bet the first question that you're asking yourself is, now what? Stick with us and we'll let you know what your options are and how to prepare. Firstly, and the most important thing to know is that you do have options. Having a baby is a really big deal, and you have a lot of decisions to make. I know you may feel overwhelmed, but we're going to talk you through some of those options now. You can choose to keep your baby, to give your baby up for adoption, or to abort. We'll go over resources for all of these options in this video. There are two options for clinics in Western Pennsylvania that can help educate you on your options: the Allegheny Reproductive Health Center and Planned Parenthood of Western Pennsylvania. They are each centrally located and can be easily reached using public transportation. When you arrive at these clinics, you will meet with a certified counselor. The counselor will discuss your options with you and help guide you to make the right decision for both you and your baby. So let's talk about what to do if you choose adoption as your option. Several adoption agencies for you to choose from in Western Pennsylvania. These include the Children's Home of Pittsburgh, Genesis of Pittsburgh, and Adoptions from the Heart. When you contact an adoption agency, many of them will have you complete what they call an adoption plan. You will meet with a counselor provided by the organization that you choose to come up with a picture of what the next 9 months will look like for you, your baby, and the adoptive family involved. The plan may include how you will select the family for your child, if you want an open or closed adoption, preparing for birth, what to expect after birth, and more. Your adoption plan is personal to you and your baby. The Children's Home of Pittsburgh uses the following process for adoption. Firstly, you contact the Children's Home by following one of the methods listed on the slides. They will connect you with a birth parent counselor who will help you determine whether or not adoption is the right choice for you. If you decide that it is, you will move forward with that counselor and come up with an adoption plan. The Genesis of Pittsburgh and Adoptions from the Heart follow very similar procedures. You can contact them at the numbers listed below.
Now we will discuss pregnancy, including prenatal care and what to expect over the course of your 9 months. Prenatal care is the health care you get while you are pregnant. Prenatal care can help keep you and your baby healthy. It includes your checkups and prenatal testing. Prenatal tests are different procedures that make sure you and the fetus are healthy. Some prenatal tests find birth defects and other problems. Early treatment can cure many health problems and prevent others. You can start getting prenatal care as soon as you know you are pregnant. It's actually best to see a doctor before you get pregnant, which is sometimes called pre-pregnancy care or preconception planning. But if that's not possible, just begin prenatal visits as soon as you can. How often you will get prenatal care depends on how far along your pregnancy is and how high your risk is for complications. A typical prenatal care schedule for someone who is 18 to 35 years old and healthy is every 4 or 6 weeks for the first 32 weeks, and every 2 or 3 weeks for the 32nd to the 37th week, and every week from the 37th week until your delivery. Your doctor might ask you to come in for checkups more often if you have a high-risk pregnancy. Your first prenatal care visit is usually the longest one. You'll talk with your doctor about your medical history, as well as the other parent's medical history and your family's medical history. Your doctor will give you a complete checkup, usually with a physical exam and different tests to make sure you are healthy. These different tests can include measuring your height, weight, blood pressure, breathing, and pulse, a urine test, a breast exam, a pelvic exam, a pap test, testing for sexually transmitted diseases, and screening for things like diabetes and hepatitis B. During your follow-up prenatal care visits, your doctor, nurse, or midwife will examine you to make sure your pregnancy is developing well and that you and your fetus are healthy. During prenatal care visits, your doctor, nurse, or midwife may also update your medical history, check your weight and blood pressure, check for swelling, feel your belly to check the position of your fetus, measure the growth of your belly, and listen to the fetal heartbeat. Checkups are also a great time to talk about any questions or concerns that have come up since your last visit. Unfortunately, almost everyone feels uncomfortable at some point in their pregnancy due to many changes to your body. For example, you will get bigger as the fetus develops. Your uterus will grow up to 18 times its normal size, and your breasts will probably get larger too. It's actually normal to gain up to 35 pounds during your pregnancy. Some other common issues of discomfort include nausea or vomiting, especially in the morning, swollen and tender breasts, heartburn, constipation, aches and pains in your lower back and hips, tiredness and fatigue, and trouble sleeping. The good news is there are things you can do to feel more comfortable and relieve some of those common pregnancy discomforts. For example, you can change your diet and do light exercise. For nausea and vomiting, try eating small meals throughout the day and drink plenty of fluids. You can also try to avoid strong spices, strong odors, and greasy foods. For heartburn, it's suggested to wear loose clothes around your waist and raise your head with pillows while you sleep. For constipation, eat food with lots of fiber, such as fruits, vegetables, and whole grain breads and cereals. Your doctor, nurse, or midwife will have more tips for feeling better during your pregnancy. There are many common items that you can purchase in preparation for your baby's arrival. For diapering, it is recommended to get newborn-sized disposable diapers, diaper cream, disposable baby wipes, a changing table and pad, and onesies. For bathing, it is recommended to get a baby bathtub, baby shampoo and soap, a soft brush, and towels. For sleeping, it is recommended to get a crib and crib mattress, bed linens, blankets, and a baby monitor. For nursing or feeding, depending on the method you choose, you will need baby bottles, bibs, burp clothes, and a breast pump. Other items include an infant safety seat for the car, a stroller, and pacifiers. It is important to know that women in every state can get help to pay for medical care during their pregnancies. Every state has a program to help with reduced cost prenatal care. Programs give medical care, information, advice, and other services important for a healthy pregnancy. Contact your local health department for more information about these programs. You can do this by calling the toll-free telephone number 800-311-2229 to connect to the health department in your area code. If you don't have health insurance, you may also be able to get low-cost or free prenatal care from Planned Parenthood. Contact the Pittsburgh Family Planning Health Center for more information at 412-434-8971.
Kristen has discussed the fundamentals of prenatal care. Let's talk about what you and your baby will experience during the 9 months of pregnancy. Pregnancy is split up into 3 trimesters. The first trimester actually starts before you're even pregnant, on the day of your last period, and lasts through the 13th week. Your baby grows from a tiny cell that you can't even see all the way to the size of a lime, or approximately 2 to 3.5 inches long. During the first trimester, your baby will begin to form its organs and nervous system, and your baby's heart will start to beat. You can see the heartbeat during the ultrasound or hear it via a Doppler system around 10 to 12 weeks. During your first trimester, you may start to experience pregnancy symptoms, but it's not unusual for you to experience no symptoms at all. You may experience breast tenderness, some bleeding, fatigue, heartburn, and aversions to certain foods and drinks. These are a few of the most common symptoms to experience. You should gain about 3 to 6 pounds over the course of this trimester. The main thing to do during this time is to start talking to your doctor about prenatal care and following all doctor recommendations to keep both you and your baby healthy. The second trimester lasts from 14 weeks all the way until the 27th week of pregnancy. Your baby starts to grow even more, and by the end of the trimester, they are the size of a head of lettuce. Around the 14th week of pregnancy, you should be able to determine the sex of your baby via ultrasound. Your baby's eyes may start to move and they begin to suck their thumb. Perhaps the most exciting part of this trimester is by week 25, the baby will respond to familiar sounds, like the sound of your voice. For the mom, you will start to show your pregnancy by visibly gaining weight. You'll feel your baby move for the first time. You may experience some pain in your back or skin because it's stretching, but this is all normal. Any uncomfortable symptoms experienced in the first trimester may subside. The third and final trimester is from week 28 all the way to the birth of your baby. During this trimester, the baby will start to practice breathing. It will be able to detect light and movement will be more frequent. Your baby will rotate so that its head is facing down and get ready to come out of your belly. During the third trimester, you may start to have false labor contractions as your body gets ready to go into labor. It may be a good idea to begin to take childbirth classes in order to prepare yourself for birth. You may feel hot due to your fluctuating temperature because of your hormonal imbalance. Your ankles may swell, so you may want to wear compression socks to help the swelling go down. Finally, your water will break and you will go into labor. Discuss with your doctor a plan for labor and delivery. You may opt for induced labor or a C-section. Your doctor will help you to decide what will be best for you and your situation. Congratulations, you've made it to the end of this video. We are wishing you and your baby the very best of luck over the next 9 months. If you want more information about what will happen after birth, please check out our postnatal video on the SHRS Wellness Pavilion.